Hi, everyone. Welcome to today's episode. I'm here with Hemant Kumar Setcha, CEO and co-founder of Health IQ Plus. How are you today, Hemant?
Doing fine, thank you. How are you?
Excellent, excellent. Now, just so everyone knows, Hemant is actually in Tokyo. He's got a very interesting story. He's the first person that I've interviewed for this series in Tokyo, but welcome anyway, Hemant.
Nice.
Thank you so much for accommodating the very challenging schedule at times.
Thank you. Thank you. It's an honor to be on this program. Thank you.
So let's just by talking, just start maybe by describing your company and your core product, Hemant.
Okay. So we help doctors engage, educate, and empower patients. And it's an AI-powered healthcare education platform, personalized, interactive. And as we know, there are 5,000 medical journals published today in the US alone, which means there's an overwhelming amount of information that's growing drastically every day. There's no way a doctor can keep up with this information. There's no way a patient can keep up with this information. There's no way a pharma company person can keep up with this information. We need a Netflix of education in healthcare. And that's what we do through using AI. And it's curated information from known sources, from public sources, and that's provided into your inbox as in the format of a video or a PowerPoint based on your requirement.
So I think because I know you've demoed the product for me, and I think what I was fascinated with was just your ability to create really high quality micro videos. Just tell us a little bit about that and how you sort of came around to that approach.
Yes. We live in a world of TikTok and we want everything very, very fast. And we all know that the burnout in doctors and nurses is so high that it costs the US industry about $4.9 billion alone just in burnouts. And there's no time anybody has. So what we devised is a way to have an assessment. And based on the assessment that you get wrong answers on some of the questions that are asked based on the information that's provided. The video that we create will be only playing on the part of where you got the wrong answers, shrinking time by 30 to 50 to 60 times. So it's personalization to the extent of everybody's knowledge, not just the demographics of the information, not just the epidemiology of the patient. So that's what we get to the core. And these are all 2-minute, 3-minute videos. And if you want to educate a doctor, it'll be a combination of these videos based on the assessment. If it's a patient, it's 2 minutes, 3 minutes summary of everything that the doctor wants to say. Sometimes you might have side effects. Sometimes you might have disease information, or you want to know when they should call the doctor, when they should go to the ER. There can be a combination of videos. It could be one video depending on the requirements of the doctor.
So let's just talk a little bit about the patient experience. So I think when you first showed this to me, I mean, obviously, like patient goes to a doctor, you go to the doctor typically because, you're not feeling well or there's a problem. Of course, hopefully you go for a checkup, but even it's always a bit of an anxious situation. And then, of course, whatever, you get your diagnosis and then typically, you get like, whatever, some kind of packet of information and then you're expected to, whatever, follow it, right? So tell us a little bit about from your
Yeah.
perspective, like how your solution changes that patient experience and the interaction with the caregiver.
Right. So when we communicate something, let's say I'm going to take in a scenario of a doctor communicating to a patient. 90% of that information is forgotten. It's not heard. It's not remembered. And what they remember, that's 10%, is also wrong information when you do the statistic analysis of the situation. And that's because the format of the information that's provided to the patient is in a written format, and half the people don't read the information, more than half actually. And the empathy of a doctor is more important than the competency of the doctor. That's also statistics known. So if a doctor is empathetic, the patient thinks, oh, he's a good doctor. And the scoring is better. So your insurance recovery is better. Penalties are lower. So you need to be able to empathize, but the doctors don't have time, as I just said earlier. And if you give the video format information, they can hear it again and again, and they can retain it for longer. They say you can retain video information 4 times more than the written or statements, and it's more than twice if it's a verbal statement. And doctors see about 20 to 50 patients a day, and they don't have enough time to convey everything to a patient. So, and he's going to retain only 20%. Might as well be having an adjunct video that summarizes what they want to hear or an additional questions they might have. You can send the video in their email box after having a consultation session. Does that make sense? I mean,
Absolutely.
you can have more retention, more persuasion. The adherence to the medication is better. The cost to the hospital is going to be less because you don't have at night people calling. I feel like I have a heart attack. I have a congestive heart failure or something, and they know when it's a acidic reaction or it's a heart reaction when they need to call the 911 or when they need to call the doctor. So that also is clear that reduces the time of communication and increases the efficiency, increases the loyalty of the patient to the doctor.
So, one of the questions that comes up often when you have AI in healthcare is like around privacy and security. Tell us a little bit about how you've addressed that.
So, first of all, the most common way of communicating our videos to the patients is emails. And we give choices. Either you want it in their WhatsApp or in Japan line, or you want to give them a short SMS message. But when you have the consent forms, usually you have a line saying, we can communicate with you on email. You already have that consent management form in the beginning. So when the doctor is actually showing it to them, showing is at the choice of the doctor, right? But if the patient is supposed to get an email with a link to the video, which can be sent in an email, which you already have the consent management in the beginning. And we don't store that which patient got what link unless the doctor gives us that permission. And we have EHR integration as well. Yeah. And it's third party, GDPR. We take care of that as well. HIPAA compliance is there. We will take consent from the patient before it's sent to the patient. Verbally, as well as you already have the consent form. Either you will change your consent forms to be more specific, or it's generalized in many hospitals and in many clinics that use our software.
So I guess, like in my case, like my hospital network that I work with, they have an EHR system, and I guess you could even just send the video to within that system, and then they would get a notification to log into the system and access the video there. Is that possible?
Yeah, yes. There are two ways to do this. One way is you leave the system to us and we take care of it. And we have an intermediary organization which does the integration with more than 70 EHR systems in the United States. So they're very popular. They take care of the GDPR. We only have the ID, partial data of the ID, which we send our nugget ID, and the video can be opened by the link that the hospital sends to them. That's the physician sends or the nurse practitioner sends to the patient. So that's one way to open up the link. And that link could be sitting anywhere in our server. It's actually public general information. We don't have any patient names or age factors to general information. And that's one way to deal with it. The second way is, yes, we can put our software systems, the videos, onto the EHR system itself of the hospital, depending on the size of the scale of the project. So, and we can do it by phase as well. And then, so the data will be sitting on the hospital server, and that's sent to the patient from there. So that's another way to do it, which they already have. Many hospitals have their application for each patient, which they already communicate their records, their past data, their billing account, everything on it anyway. It's just one extra icon which we can have for watching their education material on that, which is sent specifically by the doctor to that patient.
I think what's interesting about that is it actually gives the patient a reason to go back into the EHR and probably makes it even more, engaging and useful for the patient.
Absolutely. Yes, Dario, you said it.
So I think what else is interesting is utilization of AI to help create something in a very, very quickly, but very high quality in a way that was very difficult before. Obviously, when it comes to, medical information, there's a lot of concern or it has to be right, the efficacy of that information. What are some safeguards that you use, Hemant, to ensure that whatever video gets created is actually, the right recommendation to the patient?
Yes, thank you very much. That's a very good question, Dario. So first of all, we have a title of a disease or a drug name, whatever you call it, and then there are templates we say, okay, you need the introduction, you need a mechanism of action. Some doctors say we don't need the MOA, we need that at the end, or it's out, for example. So the script out is really trustable script out of the AI. And then the video matching from our 16.4 video scenes, matching to the text. And then the verification done by our pharmacists, nurses, and doctors who are internal, who verify the information is accurate or not. And all the sentences that came up in the script has sources already. So we validate those sources as well, opening up and checking that they're correct sources. So the turnaround time is about approximately, we promise, an hour from the time of creation. We can do that internally. You can give us a list, or you can say on the fly, can you have this script created in an hour? You can have it either in a day. Most of the doctors say in a day is good enough, Hemant. If we give you within 24 hours, if we have the video, we can send it to the patient. It's not there in our library. That's good enough. And the library gets better and better and better. Right. And it's more trustable because we do periodic checks on those library modules. And also, when it comes to oncology, cancer patients, we even have external subject matter experts, not just our internal, to make sure that the accurate information is there, because there are 2 or 3 or 4 new drugs coming up every month. Yeah. And it's so difficult to keep up with the landscape changes. And there are many medicines which are retracted. So we keep up with that information by our internal medical affairs team, but we also have external SMEs. And then you have the doctor who's, before he's sending it, he's already heard everything and he knows which video he's sending to the patient. Yeah. Does it make sense?
Yeah, absolutely. Absolutely. So tell us a little bit about how you go to market, Hemant.
That's a very good question. I'm trying to figure that out myself.
Yeah, I know,
AI is changing all the time. It's evolving. So first of all, okay. So what I'm planning to do, we are looking for investment. Let me be honest with you.
Yeah.
And then we are looking for almost like a 1 or 2 months free usage. Video making is a costly affair. And then you make one mistake every time you make an editation, that's a new video created, and people don't see that. They say it's the same topic. They say so. We have a robust library as we're growing. Yep. So when we go to the doctor, we say, give us your top 10 videos that you usually use, and we'll give it to you for free in the setup. Yep. And as you grow, we will make modifications, and in the monthly fee, we'll make the changes as we go along. If you need anything new, that'll be extra cost. Yep. And that's 10 knockoff less than the market prices. Right. And the time is less than a day to create the next video and to give it to you in the library. That's an amazing speed compared to when I was in charge in one of the pharma companies, and we were creating this in 3 weeks to 3 months.
Oh, yeah.
So, and the cost was like 2 zeros more. Even if it came down by 1 zero, that wouldn't have been enough. And now we would do it with 2 zeros less compared to that time, and 1 zero less compared to our competition.
And then I guess the value prop then to the health network or to the physician's practice is better adherence to the care, right? Which drives a better outcome, better patient satisfaction, and then less burnout, I would think, for the physician and for the nursing staff. Is that kind of your value prop?
Absolutely. Yes, that is. And there's one more thing that we really need to remember is liabilities issues are less because you have pre-vetted content. There's no way a doctor can keep up with the same kind of a script and all the same KPIs he's supposed to mention to the patients. As we know, 82% of the hospitals in the US alone are having some or the other kind of penalties. That's in billions of dollars, double digit. That's how much penalty because of I said, not said situations. Yeah. Just by general knowledge information passage on adherence, for example, can save about 1/3 of those court cases, what I'm told.
Wow.
So the value proposition is huge. And the time of making these videos in an appropriate way is templates that we have from our experience can be really, really, invigorating in the sense of the doctor feeling confident that he has all the information needed. So it saves him time in thinking what he should have, what he should not have. So our videos are pretty much balanced in terms of the introduction, for example, side effects or serious side effects, what to do in an adverse event situation, all that information, 20 seconds, 10 seconds, depending on the size of the video that you want to create. Average size is about 3 minutes. Those are very powerful experiences that are required in today's era we live in and reduce the cost. So it's cheaper, faster, more efficient way of working.
Yeah, yeah, awesome. So I know you had mentioned to me that you had just gotten fundings. Tell us a little bit about your funder. It's always funny when I talk to founders, and tell us about your fundraising experience and maybe some of the
Oh,
lessons that you've learned. Because this isn't your first rodeo either, but
yeah, it's not my first company that I'm running, but we have funding from two different sources. One was the JETRO program, the BDCD business development in Japan. They semi-funded my product development. And then the US side, we have a very major zero day one, the what do you call them? Shark tanks
yeah,
bidding on our funding. So I recently received a letter of intent to go forward in that funding. I have other 7 to 10 prospects of receiving funds. I need to figure out how to receive those funds and how to put the market cap so we are a unicorn company. In the future, we plan to go IPO in 4 to 5 years. So this is a very aggressive path forward. I want to keep up with the sales growth, but that'll be only possible if I get the funding. Right now, my hands are full. And we are going with the aggressive, fast decision makers forward. If the time is like going to take 3 to 6 months, typically that's what pharma companies do take sometimes. We say, okay, we'll get back to you, or they'll get back to us later on. And I keep it on the back burner until they get back. So that's how we are proceeding forward. It's an interesting time we are living in. AI landscapes are changing all the time. And our value proposition is very, very unique. We have patents filed in US, Japan, and in India. I could not file or afford it in the Europe at this time, but I will once I get the funding now, which is coming in.
gotcha, gotcha. So just kind of wrapping up here, this has been incredibly insightful, Hemant, and congratulations on all of your success to this point. What are maybe two or three lessons that you've learned that you would share with other healthcare AI CEOs who are maybe going down a similar journey?
Oh, there's a lot of what we call fingers burning when you're doing this.
Yeah,
A lot of experimentation you have to do. Really, is going to work out or not. And we have tie-ups with multiple AI companies as parts of the engine we built together. We're not billion-dollar funded like OpenAI. We're not billion-dollar funded like Microsoft's or Gemini or Grok. So we are very judicious in our choices of what platform to depend on, and we don't want them to go out of business when we're going along. So these choices that we make along the way are very, very carefully thought through. And one more thing is that AI is changing so fast that if you're going to wait for that AI to be settled, I think it's too late. And if you don't tame the fire, it's like fire, I would say. If you don't tame the fire, you're going to get burnt anyway. So might as well learn how to sit on an AI, get on the AI path as soon as possible so you are able to tame it as you go along. Otherwise, you're going to be out of business if you don't do AI in today's era.
for sure, for sure. Awesome. Well, this was just a great interview, Hemant. Thanks so much, and all the best of success going forward.
Thank you. Thank you very much, Dario, for this opportunity, and I look forward to seeing you again soon.